I'm founder of PROBr, a neurodisability physiotherapist, and I'm so excited to discuss about the mental health in the Black community. And I will give you a little bit of a background of Dr. Stewart here. He is a psychiatry resident. He's one of two Black people in his medical graduating class. He's from a diverse city with an underserved population. So without further ado, Stewart, if you can kind of introduce yourself a little bit more and tell us about how you got started in psychiatry.
Well, thank you for having me. I'm excited to be here and to talk, but I think you kind of hit a lot of the high points. My name is Stewart Lockett. I am 28 years old, which sometimes feels a little surreal to say, but I am a psychiatry resident, a first year resident, and I'm from New Iberia, Louisiana. It is a very small town in Louisiana. For people who are not familiar with Louisiana, it's about 2 hours west of New Orleans, and it's right at the bottom, right above the Gulf, kind of in the smack center bottom of the state. I grew up there. I went to medical school in Louisiana, and I went to college in Louisiana at LSU, Louisiana State University, and now I am training for psychiatry. And I'm excited to be here and to talk about, one of my favorite things to talk about, which is mental health in the Black community.
And also, I never heard of Liberia, Louisiana. I mean, when you said Liberia, I thought,
So,
wait, the country in Africa?
so, so it's New Iberia. I know everyone
Oh
always says that
my,
they're like Liberia. So it's New Iberia. I'm working on putting it on the map. You gotta keep saying it until people know what it is. Funny enough, I actually was on the Kelly and Mark show, and I was talking to them, and they have some friends from New Iberia. So just putting it on the map little by little.
that's amazing. And so, how did you get into psychiatry? I don't know if I'm, jumping the gun here, but maybe kind of walk us through if it started in high school or maybe if it even started 5 years ago.
Yeah, I would say it didn't. Some people have stories where they're like, my passion birthed when I was 5. I always knew I wanted to be a doctor. I think if you ask my parents, they would say yes. He always told us this. We kind of always knew, like it wasn't much of a surprise. No one was surprised by this decision. Now to go into psychiatry, I think people were surprised. But I would say, within, the last 5 years, seeing so much about people's health, their health literacy, how they view their own self when it comes to relations to healthcare. It boils down so much to how they view themselves as a whole, how they view themselves in relation to their own behaviors and actions and how they see themselves in the world, right? Psychiatry, to me, I always tell people this, it is the root of medicine, right? Because medicine, it's these things where you have to take medication every day. You have to do preventative medicine. You have to go to these doctor's appointments. You have to sign with consent. You have to have capacity. All of that, to me, unfolds with psychiatry. So in medical school, I mean, I fell in love with it. I absolutely loved it. But and since then, I mean, I wake up every day very excited to do what I do and to be able to practice psychiatry.
So, how is like your residency so far? Have you met any patients that you felt, okay, this is something that makes me want to get up every day to do? And have you seen any results in terms of like your interventions and treatment plans with them?
Yeah, I mean, I see results all the time. I'll bring up one patient specifically. I was working in the psychiatry emergency service. So I was in the emergency department, and I think I had about 4 medical students with me. And I always try to give my medical students a good journey. I try to keep them interested. We had a patient, and I mean, this patient was not speaking at all. Having active mania, had been reported to have very controlled bipolar per her family, and was not doing well, was unwell. So we admitted this patient. We had to put this patient on what we call an involuntary hold. We had to bring this patient into the inpatient unit and treat them as well. So at the end of the week, I told my students, we weren't as busy on the Friday. We saw this patient on Monday. I said, let's go look at the patients we admitted, because I wanted to show them just how much better patients can get. And I mean, this patient, she looked at us, and she looked at me in the face, and she was tearful. She was speaking, she was engaging. She said, thank you so much. She said, I stopped taking my medication, and you admitted me. Thank you so much. And really, I didn't do the groundwork. The inpatient psychiatry team did the groundwork but I was the one who admitted her. So, I mean, just working as a team and a collective, that was really beautiful. It was really a moment. And to see medical students be like, this is not the same person we saw. It was beautiful to even for a learning experience.
So when you say students, do you mean people that are shadowing you?
Yeah. So
Or
when I say students, I mean these are medical students and they're on their third year rotation. So they rotate through every single service. So they work with us, the residents, and the attendings, and they shadow, I guess, in a sense. But they're a part of the team. You know, they're in there asking questions, writing notes, coming up with plans, reminding us to do things that we forgot. So they're part of the team.
well, speaking of students, I guess being one of two Black men graduating in your class, how was that? And I guess being a resident, not a resident, but a medical student and all that.
Yeah, so I had a bit of a transition period in medical school. So I did graduate as one of two Black men, but there was a time where I was with a few others, and they were really, really helpful. But it was not easy. I mean, I think the short answer, it was not easy. There were moments of isolation where you just felt as if though, I'm the only person who looks like me. I mean, it's obvious. I don't really have you know 20, 30, 40 other people who look like me, 20 other 30, 40 people who have my similar experience. Luckily we had about five Black women graduate with us, so I had some shared experiences with them. But unfortunately, a lot of the times it was just me, and I think I
Yeah.
was the only one who actually participated, me and the other gentleman. I was the only one who participated in the graduation ceremony, which also felt a little isolated. You're celebrating this big moment, but you're saying really this big moment, but put to go into a field that is still so underrepresented. You kind of have these conflicting feelings like I'm happy, but the work is not done. The work is still to be
Yeah.
done. And this is just a small, small step.
And how would you, I guess, like, what advice would you give to more Black men who may want to get into medical school, and or maybe those who may be in your position where they feel alone? Like, how would they overcome that?
Yeah, I would say, call, reach out. Instagram, social media is so powerful now. Reach out to people. They want to help. I want to talk to Black men who, want to go into medicine. Just to encourage them and to hear their stories and to connect with them. It's so beautiful because my undergraduate, Louisiana State University, and the bioengineering program there, they do this mentorship program where you have to reach out to alumni and do an interview with them.
Oh, nice.
And yeah, and the staff there have been so great. There's shout out to Nick. He pairs the alumni with the students, and he does such a great job with pairing me with any Black males that are interested in medicine. And he connects us because he knows how important that is. And from that, I've got to meet, I think, at least five students over the years. I probably say more than that, probably somewhere between 5 and 10 that I've got to at least connect with and hear their stories. So do that. Hear the stories, hear the real of med school, hear what you need to do because, it's hard and it can feel isolating and like I'm the only one who went through this and you're not. And, I'm here to tell you it's hard and I'm here to tell you the struggles to expect, but that you can do it.
And is it so? I know there's like different ways that medical school can be hard, especially being someone who's like the only person, like, the only Black person there. But what types of struggles, like, is it kind of talking to someone and asking for help in terms of like the lesson plan, or being able to, I guess, not code switch in a way, being able to be yourself, or culturally, you just give us a little bit more.
Yeah, all those things plus more. I won't be able to touch on all the struggles that Black students face, but I was looking at some research the other day, and one of the research said that one of the reasons that Black students feel burnt out is because they have this extra burden of diversity, right? They are
Yeah.
always asked to be this. Can you come speak on this panel? Can you take a picture in here? Oh, we want you to do this, which is like another job that you're
Yeah.
not getting paid for, right? So that was some of the research I looked. I would say personally for me, some of the hardest parts was I didn't know what to anticipate. So I would take these exams, and for example, step one is the USMLE, United States Medical Licensing Exam. It's our very first exam. And if you don't have a lot of Black mentors, if you don't have a lot of close mentors who really tell you what to expect, how to study for this exam, how hard it is, what materials you need, how expensive it is, and how taxing on your mental health it can be, you're really not set up for success, right?
Yeah.
So that's one of the biggest things I thought is academically having someone who looks like you to set you up for success was a very, very tough thing. Um, Also, I would say the second thing is community, right? Having other people who look like you know, laugh like you, laugh at the same jokes, tell the same type of
Yeah.
jokes, relax the same type of way you do, because that's important. You can't be
Mm.
serious all the time and study 24/7. And I will say, you know, at LSU Shreveport, we were able to build some of that. You know, when I was there, I saw our community build. I saw us have events. So that was inspiring. But I would say when I got there, I didn't really have that. There were about 2 years where I didn't feel like I had a strong, robust sense of community. I just didn't.
Yeah, and I totally get what you mean because when I did my schooling as well, my physical therapy school, there wasn't many Black people around. I think I was the only Black girl in my whole cohort, and there was another Black guy there, and me and him were the closest. We were good friends. We talked about sports all the time, and it was just nice because we didn't want to talk about like different healthcare interventions. We didn't want to talk about assignments. We wanted to talk about just pop culture and whatever it was that was streaming. But yeah, I mean, I totally get that. You need people to laugh with, someone to kind of just diffuse like all the stress you have throughout the day. Um, but yeah, so moving on, we're going to talk more about like cultural perspectives and mental health. What do you think is like the biggest barriers in mental health?
You know, this is this is a tough question, you know, because I feel like there are so many barriers. Um, right, on so many different levels. And I think the main one I have to address is kind of the socioeconomic status, right? You have these underrepresented groups that are traditionally underserved and at a lower socioeconomic status. So they aren't knocking on those doors. They aren't meeting with the professionals to really get that diagnostic clarity and that medication treatment they need. And even if they get the diagnostic clarity, can they afford the medication? Do they have access to the medication? Can
Mhm.
they go to an appointment every week? Then, you know, that's our first barrier, right? That's like barrier one. And then if we get to a provider, we get on medication, does this provider understand us? You know, does this provider
Yeah,
really understand the struggles we have? You know?
yeah,
And that's a huge one. And I guess preluding all of those things is like, are we even willing to talk about it and get to that point? Are we willing to look at our neighbor, our brother, our sister, our mom, our niece, our nephew, our grandmother, and say, hey, like, I'm not doing well. I know I can do well, but I'm not doing well. Or am I getting shut down when I say those types of things, you know? Or am
yeah,
I being embraced and told, okay, what can we do to get you back on track? You know, how do we shift? How do we, you know, change this to make sure that you get back on track? Those are the big things. I feel like are barriers for us, and I think we don't have enough people coming and talking about it and saying I struggled. I think Michelle
yeah,
Obama did a beautiful thing. She did a beautiful thing in the early tens, and she came out and she was like, I struggled with mental health a lot. This is the first lady, the first Black first lady to come out and say this. And I thought that was a huge step in the right direction where we need to go.
a lot of the times, especially like if we go back down like decades, we were kind of told not to speak and just different systemic rules in place that forced us to not be able to speak for ourselves. And now we're in a point where we can speak for ourselves, but we don't know how to. And most of us that know how to, it's because we've invested in ourselves and we were blessed and privileged enough to do more education and be able to learn about these things. But not everybody can do that.
Right.
And
And
I
I,
think, mhm,
I even want to ask you a question. Uh, how hard was it, you know, you said in your PT class, right? How
mhm,
hard was it to get up and speak against, let's say, a professor or a faculty member and actually feel like they're not just going to be saying, you know, oh, this is one person who thinks like this, or, you know, to speak up against authority, it can be very hard, even if you have a lot of practice.
mhm. Like for me, even if I did as much research as I could, and I know I'm 100% right, just knowing I'm speaking against someone, I'm just like, okay. I'm not going to win this, even though I know I have the facts. And it's about
Right.
the confidence, also a mental thing as well. And what would you say, like the stigma around the mental health? How is that in the Black community? Because I mean, I think right now I do see like a general consensus that there are more Black women that are more open to the possibility of understanding what mental health is and possibly seeking some assistance with that, whether it's talking to someone like a close friend or maybe seeking professional help. But when it comes to the Black men, like how do you see that? And I guess in our community in general.
Yeah, I mean, I work with a lot of Black patients. Jackson, Mississippi is over 60% Black, so I work with tons of Black patients. I what I'm starting to notice and what I'm starting to see is people, specifically Black men, will come in. They will be willing to get help, but sometimes it's when it's too late, or when it is, maybe an acute crisis, right? I think we're still struggling with the preventative care. We're still struggling with people saying, "Hey, I'm not feeling too great. I'm going to go and see a doctor. Hey, this thing I'm thinking about struggling with, this addiction, I need to get some help with this type of thing." It's usually we're seeing someone when they are like making an attempt, or we're seeing someone when they're like actively having psychosis, or we're seeing someone in an overdose, and then I will hear more conversations about, hey, I might need to get some help. I'm ready to take those steps to get some help. But the preventative kind of aspect, I still see there's a lot of hesitation around. And I still think there's a lot of groupthink. I spend a lot of time in barbershops. I like to get my hair cut. That's just what I do. I try to go every 2 weeks.
Oh, it
I
looks
mean,
good.
thank you. Most Black men, they're trying to get in every 2 weeks. Some people go every week. I don't have money like that. I'm on a resident salary.
Pro tip: do not get in it every 2 weeks because you're gonna see a pushback. Just
Oh,
saying.
that's true. Then you gotta let your barber know, they're not doing a good job. They're pushing it back. But every I try to go as frequent as I can, and I still see this kind of group think mentality, where, it is kind of, sometimes people will speak up for mental health, but a lot of times, in these group mentalities, it's kind of, um, nothing's wrong with me, I'm good, everything's wrong with everybody else, kind of a bit of a pride and an ego still. But I do think it's getting better. I think it is getting better. I have interacted with a lots of Black men online who are promoting mental health, and I think it is improving. Um, so I am hopeful.
That's amazing. Okay, so when you brought up a good point about we usually seek help when it's too late, and that is so powerful. Why do we wait?
I mean, I think that's a systemic issue, right? I think now with the newer generation, we do have to know generations learn stuff from the generations above them. And I would say rightfully so, there was some mistrust between the generations above us with the medical system. A lot of people feel like they are not being heard. And I will say working in that in healthcare, this is going to be a hot take. People might not like this one, but a lot of people are not listening. A lot of doctors, a lot of providers are not listening to patients and are not listening to Black patients. They're not believing them. When they're in pain, when they're saying they're struggling with these things, they're not believing them. And this is creating a level of further distrust, right? Because it only takes, people's emotions, that they can be such a complex thing, but really it can take a very first impression, and somebody will generalize every single person they meet from them, right? So if you have one bad impression with a doctor, or like,
It was.
kids, some kids will say, I hate going to the dentist. Why? Because they had one bad impression where they pulled their tooth when they were 3 years old, and it's etched in their memory, and subconsciously somehow they still remember that the dentist is related with pain, and they will never forget, and now they hate the dentist. It's the same thing. They meet a doctor, they feel not heard, and then they never want to go back again. And I think it trickles down. And the way we change that, I think, is we become, one thing I think is doctors become more personable. They become people. It's not, oh, you go see your doctor lives in a separate neighborhood. They don't go to the same barber as you. They don't do any of these things, because that's what doctors used to do. They used to be on a different pedestal. And we bring that down and we say, my doctor is Oh, I have a friend who's a doctor. I have a friend who is this. I have a person of color I know who is a doctor. I have another black male I know who's a doctor. He's just like me. We sat in the same chair. We sit in the same barber chair. So he is like me. I can trust him. He's to be trusted. So I think that's some of our issues, and I know I'm a bit passionate about it. I can really get revved up, but I think it is so evident in our community.
And I guess what ways can we, like, what steps can we take to, I guess, rectify that in our community, I guess, like in terms of ensuring that we take preventable steps. I know we can say education, but what are actual actionable steps that we can take?
Yeah, and I mean I think the actual steps are where the country is trying to go backwards at, right? I just laid out the problem. I think that is why diversity, equity, inclusion, and belonging are so important, right? Because we build the trust by having doctors of color. We build that trust, and when they see someone like them and they can build a connection and have, mutual foundation, then they can trust that doctor and really buy into the treatment. They can really trust the treatment process. And I think we start right. Everybody always says, start at the schools, start at that. But we do. We have to educate them, and we have to get Black providers in spaces to see other Black patients and to continue to build that trust. Black providers in those meetings, right? We don't. And not just Black providers. Oh, we're just going to send you out to see other Black patients and that's it. No, we need Black providers, Black administrators, Black business people at the table that are making these
Yeah.
decisions that are in the best interest of other Black people as well. And for some people, they
Mhm.
don't like to hear that, and that's just the truth. That's the truth.
It's true, like representation does matter. And it's the reason why there is a lot of mistrust. Because if, no offense, but if I don't see more Black people around in different spaces, I'm going to think, well, they understand how I'm feeling emotionally. Because sometimes it's not even about what we know objectively, but also, will you be able to understand what I'm coming from? Will I have to over explain myself for you to get to my point, basically? There's so many things, like so many nuances that are involved in it. And I think not just us, but other people need to understand as well. Like, just everyone needs to understand this. Um, but like an anecdote I have. So I was reading an article. It was in Kingstree, South Carolina. You may have heard of it because it's in the southern state.
Hmm.
It says this physician, basically he sees patients every 20 minutes. And a lot of those patients, because South Carolina, they don't have Medicare. So a lot of those patients don't have insurance. You either have to pay out of pocket or have really good insurance. So and it's a heavily Black community. It's a town there. And a lot of them don't see a doctor. It's either they don't see a doctor and they just deal with whatever condition they have. And it's a big issue because South Carolina doesn't want to give them, I think it's Medicaid or
Hmm.
Medicare. I can't remember one. But yeah, that's just one of those states that it's just, I mean, they're obviously set up for failure.
Yeah.
Yeah.
And you're saying this doctor does 20-minute visits? Does he do it at like a low cost or a prorated cost?
I think he sees them every 20 minutes because of the wait list. I'm
Ah,
pretty sure the article didn't go into depth about why he sees them every 20 minutes, but he says that he's obviously the only Black physician in that town. So he has a lot of patients to see. So it must have to do with the capacity.
I see. Wow.
Yeah, I could send that to you actually, and you can have a
Yeah.
read. Was actually, yeah, I was shocked by that, how that
And
happened.
the need is there. The need is
Mhm.
so much there. It's there.
Yeah, and I wanted to talk about like what I mentioned in the beginning, like how, I guess, did what happened to you in your personal life with your father, did that shape you into going into medical school, or and did anything occur where it was, I guess, negligence or anything for that matter, or not on his end, but like from the medical team?
Yeah. Yeah. So, that is a great question. Losing my father, it truly is a beautiful story to reflect on. At the time, it didn't feel beautiful. It felt like life was in shambles. Now, but we're almost at 10 years now, and it's hard to say it's been 10 years, but
Wow.
he got diagnosed with stomach cancer. And my parents, let us know kind of what was going on and the diagnosis. He went to MD Anderson. Um, I was pretty young. I was about 17 at the time when everything started to occur, maybe 16, turning 17. He passed away when I was 18. I was new, I was freshly 18. And
Yeah, you're
he
very
went,
young.
he went to MD Anderson and he got great care. From my understanding, the doctors gave him great care
Hmm.
and they were trying to do really everything that they could do. And he even, explored kind of like trials to partake in. But at the time of his passing, he did know I wanted to be a doctor. Like I said, this was very evident for years in my family. And he did refer to me several times and say like, hey, I want the doctor to give me the medicine, referring to me. I want him to actually give me the medicine, and I'd be taking care of him in different ways. And I think it really changed me. I think, and I say this, with a smile on my face, for the better. It made me more compassionate in a way that I don't think I would have ever developed the compassion I could have. I think, um, losing someone that young and in such a way where it is intertwined in the medical field is so motivating, and it is so grounding. I think that's the best word I can think. I feel so grounded since that experience. And I would have loved for him to see me graduate medical school. I think he would have told everyone, and he would have literally probably exhausted me from like parading me around so much. But I think it would have been out of being proud. Um, yeah, so I
Yeah.
think it was definitely a revolutionary experience.
At a young age, 18 is very, very young. Something similar happened to me. Lost my mom at the age of 22. It gave me a different perspective on patients and their family members. What advice would you give to someone who wants to get into medical school?
Yeah, so that is a great question, and I think the most awesome thing is I have been able to meet Black, brown, and all the types of students in medical school, students who have left medical school, students who are still trying to get into medical school, students who are been out of medical school for 30 years, right? And they're attendings. So I feel like I have now got to introduce myself to the gambit of different folks. And I will say it always comes back to not giving up. That is so cliche, but
Yeah.
like the person who makes it to the end is the one who is not afraid to fail. And if anybody in medical school, any attending says, I've never failed at anything, I think they would be lying to you, because at some point in the journey getting to medical school, whether that be high school, undergrad, medical school, residency, practicing, at some point you failed either an exam, you failed what you felt like yourself, or you can even have failed a patient or a patient's family. Um, and that is really difficult, but is getting over those humps. How do you recover from those things? Those are
Mm-hmm.
the people that are getting there and making it there. So my advice to anybody who wants to go to medical school or become a doctor is embrace that failure. Know that it's coming, and know that it's okay. It's coming, it'll happen, and you'll get over it, and then you'll move on. I had a lot of people telling me that same advice. I would say probably 3 years ago, and I wasn't trying to hear it. Maybe 4 years ago, and I wasn't trying to hear it, but it's the best advice. It somehow penetrated and stuck with me.
There is a saying, it's either you win or you learn, but there's no such thing as losing. So that is a really nice quote that you just gave. And finally, to anyone who may want to seek assistance with mental health, or maybe people who don't think they need to seek assistance with mental health.
Yeah,
Sorry.
I, I, no, you're okay. I think for anyone, and I'm going to talk from like a mental health, quote unquote, professional, mental health worker, um, is that, a lot of people in this field do want to help. Like we want to help you. Um, and to don't be afraid of, again, it going wrong. I think so many people are kind of get that analysis paralysis and they're like, well, I can't go because what if I don't like them? Or what if it doesn't work out? Or what if I don't get better? That's okay. Then we'll try something else. We'll try a different form of medication, a different form of therapy. Sometimes it takes people 2 times to get on a certain depressant medication before they get on the right one. So don't be afraid of that. You know, we are here to help you, and there are ways to access medication. They aren't always accessible. You know, when I say that, they aren't always easy, but there are ways to get care if you need it. I wish they were easier, and the government would make them easier, but there are ways.
I think this is a start, anyways, for us to start a revolution and to advocate more for underrepresented groups. So I think discussing this more and hoping for change, which we can hope for more policy changes. We can only try to work with what we have. But yeah, what you said, I love that. Thank you so much, Stewart, for just your insights, your time, and just giving us insight on how you got into psychiatry. I think this is very important and it's inspiring. I mean, it's inspiring for me.
And I encourage you to continue. I'm rooting for you. A lot of people are rooting for you. I think people don't no, one last thing, people don't realize how much I'm rooting for them, and then they'll like see me out, or like I'll be traveling and visiting a city and I'll run into someone from college or someone from high school or someone I knew as a child, and I'm like, oh yeah, I know that you went to PA school and you've been striving to do dermatology, and I'm so proud of you. And they're like, how do you know that? And I'm like, because I'm rooting for you. I've been rooting for you for years, and I try to be as public as I can, time limited, comment and text people and do all those things. But a lot of people are rooting for you, and you don't even know that. So keep that in mind.
I'm rooting for you for sure, 100%. I love your stories.
Thank
Okay. Well, if anyone wants to speak with Stewart, he says his DMs are open and you can talk to him. And I think you can reach out to him, and I don't know if there's another way to reach out to you, but his Instagram is the best way, and I'll definitely link that for anyone who wants to reach out to you. And yeah, any final words?
Yeah, Instagram, Twitter. I have Facebook. I don't get on that as much anymore, but Instagram, Twitter, email. I'm open to connecting and having a conversation. I think that's where we kind of built the foundation and make some real change.
And okay. Well, yeah, we'll speak soon, and thank you so much, Stewart. And yeah, bye.
All right. Thank you. Bye bye.